What long-term health effects did Vietnam veterans experience? Have you ever wondered what lasting impacts the Vietnam War had on those who served? The long-term health effects faced by Vietnam veterans are significant and complex. Many veterans deal with a variety of physical and psychological conditions that have persisted for decades after their service. One of the most common issues is post-traumatic stress disorder, often referred to as PTSD. This condition affects many veterans, with symptoms that can last more than 50 years after their deployment. Veterans with PTSD often experience ongoing psychological distress and social challenges. Even those who have milder symptoms, which do not meet the criteria for a formal diagnosis, report worse health outcomes compared to veterans without PTSD. The link between combat exposure and PTSD is strong, and this condition can lead to other health problems. Another major concern is cardiovascular disease. Research shows that veterans with PTSD have a higher risk of heart disease. Additionally, many veterans face multiple chronic illnesses, such as arthritis and respiratory conditions like sleep apnea and asthma. These chronic diseases often occur together, making health management even more difficult for aging veterans. Exposure to Agent Orange, a toxic herbicide used during the war, has also led to serious long-term health issues. This exposure is linked to various conditions, including certain cancers and diabetes. The United States Department of Veterans Affairs recognizes these health problems as service-related and offers health examinations and benefits for those affected. Hearing loss is another common issue among veterans. The loud noises from gunfire, explosions, and heavy machinery during the war have caused many veterans to suffer from permanent hearing loss and tinnitus, which is a ringing in the ears. These conditions can greatly affect their quality of life. Veterans may also have encountered other occupational hazards during their service, such as exposure to chemicals and radiation. These exposures can lead to a range of health issues that may not appear until years later. The long-term health effects of Vietnam veterans reflected the complex history of the war, including the intensity of combat and the use of chemical agents. These health challenges are intertwined with social and political factors, such as the delayed recognition of veterans' needs and the evolving understanding of war-related conditions. To address these ongoing health concerns, there is a need for tailored health care for aging veterans. Expanding mental health services to help those dealing with PTSD and related disorders is essential. Community support and updated healthcare programs are vital for improving the well-being of Vietnam veterans who continue to live with these long-term effects.